The World Health Organization had been hinting about raising the alert level for some time, but it waited until the virus had spread across more than one continent. The WHO's Director General Margaret Chan announced that almost 30,000 confirmed cases have been reported in 74 countries on 5 continents.
We are in the earliest days of the pandemic. The virus is spreading under a close and careful watch. No previous pandemic has been detected so early or watched so closely in real time right at the very beginning.
So what happens now? Dr. Chan says the official declaration of the pandemic means drug manufacturers will speed up development of a vaccine, although one is not expected to be available before September. Until then, Dr. Keiji Fukuda of the WHO is telling countries to maintain vigilance.
At some point, it will become established in most of the countries around the world, which means that there will be a lot of people who will have gotten infected over the next 1 or 2 years, and then we'll begin to see immunity build up in the population.
The decision to raise the virus to the highest pandemic level came after a surge of cases in Australia, as well as in some other countries. 15 new cases have been reported in the Philippines, and China is bracing for an increase in its cases. On Thursday, health officials in Hong Kong closed elementary schools for 2 weeks after at least a dozen children were diagnosed with the H1N1 swine flu. The pandemic is believed to have begun in Mexico in April. Dr. Chan says Mexico now appears to be stable, but she did not rule out further waves of infections in that country and in the southern hemisphere as the seasonal influenza begins there.
The virus raised the rules, and this one, like all influenza viruses, can change the rules without rhyme or reason at any time.
And experts say they are concerned that as the virus passes through populations, it could become more severe. Melinda Smith, VOA News.